GLP-1 medications like Ozempic and Mounjaro are all over the news for diabetes, weight loss, and more. But how do they actually work? And what's the difference between Ozempic and Mounjaro? Let's break it down. GLP-1 stands for glucagon-like peptide 1, a hormone your body makes after eating. After you eat, GLP-1 is released and it will trigger insulin, it slows stomach emptying, and it tells your brain, hey, you're full. Drugs like Ozempic and Mounjaro mimic this hormone, helping regulate blood sugar and reduce appetite. Why are they so popular? Here are the benefits. The average weight loss is between 10 and 20% depending on the dose and drug. They're also very good at controlling blood sugar. They were originally designed for type 2 diabetes, and they're excellent at A1C reduction. Recent studies show that some GLP-1s reduce the risk of heart attack and stroke. It's also convenient with once-weekly dosing for minimal hassle, but they're not perfect. Let's talk downsides. There are definitely side effects. The most common are nausea, vomiting, diarrhea, and constipation, especially in the first weeks after you start using a GLP-1 medication. They can also be very costly, around $1,000 for the pen-based medications. The vial medications could be cheaper, but they're not as convenient. And it's an injection. Yep, it's a shot once a week. There are tablets, but they're not currently as effective for weight loss. You can also have side effects such as possible muscle loss. Some people lose lean muscle along with fat. And if you don't incorporate exercise and diet and changing your habits, most people gain back the weight that they lost when they stop taking the medication. So if you're going to take this medication, really changing your diet, exercise, and overall habits is a good idea. If you have a medical history of certain pancreatic problems, pancreatic cancer, or thyroid cancer, or pancreatitis, talk to your doctor, but a GLP-1 medication may not be a good choice for you. Now let's compare Ozempic versus Mounjaro, two of the most talked about options. Ozempic, or semaglutide, was approved initially for diabetes. A few years ago, it was approved for weight loss. It's also sold as Wegovy for weight loss. It targets GLP-1 receptors only. Mounjaro, or tirzepatide, was also approved initially for diabetes type 2. It too now is approved for weight loss, and it's sold under the brand name Zepbound. Mounjaro, however, targets both GLP-1 and GIP hormones. GIP is another type of hormone similar to GLP-1. So what's the difference? Well, in terms of weight loss, Mounjaro leads to more weight loss on average than Ozempic. In clinical trials, Mounjaro led to 21% weight loss versus 15% weight loss for Ozempic. The mechanism of action is also different. As discussed above, there's a dual action with the Mounjaro with GLP-1 and GIP. The price between the two is about the same. So if you don't have insurance, it can be very costly. Are these drugs for you? Well, if you have a BMI greater than 30, you might want to consider one of these drugs. GLP-1 medications are powerful tools for managing diabetes and losing weight, but they're not for everyone. Talk to your doctor, watch for side effects, and make sure to pair with diet or exercise. If you don't do that, you will gain back the weight. I have plenty of patients who lost a lot of weight, tens of pounds, but only to gain it all back when they discontinued the medications. Problem was they didn't do the work. They didn't work on exercise. They didn't work on diet. This is not a magic medication. And remember, Ozempic and Mounjaro work differently, but both can be game changers. Like with any medication, we have to weigh the risk and rewards. My advice is that you discuss this with your physician. What are the risks and what are the rewards and how it relates to you? The science is evolving fast and your health journey is unique. For more content, please hit subscribe. I hope you enjoyed this video. I'll catch you on the next one.